Hi, I'm Liz for KelownaNow, and I'm here with Ben Stewart. Thanks for being here, Ben.
Oh, Liz, it's a pleasure to be here for the first time.
Appreciate it. So Ben is the BC Liberal candidate for the Kelowna-West By-Election. And so Ben knows that he's got about 10 minutes to cover these questions here, just like everyone else. You ready?
Yeah. Oh, yes.
Okay, so here goes. So first question is about housing. So Kelowna has a 0.2 vacancy rate. And the average home price is $500,000 or more. Average rent is more than $1,000. So how do you get new buyers into the market? And what's the solution to providing more rental options that are affordable?
Well, I think that one of the things that, cities that are fast growing like Kelowna and West Kelowna, both have to have a forward-looking plan as to where this housing is going to come from. And I wouldn't be necessarily critical, but I think that the bureaucracy has not necessarily delivered as much new availability in terms of process for developers in a timely manner. I know that from personal experience. I would say that we have to do a better job working with local government to accelerating availability. And then as far as affordability, I think that comes from overall the province has been growing so rapidly over the last few years. And I would attribute a lot of that to our economic success and the way the province was managed was that it created all sorts of reasons for people to move here. We talked a little bit about the tech sector. It was one of my priorities when I was MLA back in 2013 to put the Okanagan Innovation Center here and work with government. So that's created new opportunities, but we have to address supply as my main thing that I'll be working with local government on.
Okay. Second question here. So the opioid crisis is affecting all ages and demographics. Many overdose deaths are happening behind closed doors. First responder services are overworked. So what should be done?
Well, that's a challenging question because I think that the numbers are out today in terms of the number of deaths last year, and I'm sure that people, the numbers are shocking. And the more important part is that these are not, some of the people that are dying from this are not necessarily drug users or addicts, etc. I think that one of the things we have to do is certainly make certain that the frontline services, we've gotten naloxone kits with all sorts of people in schools and things like that, but really we've got to make certain that there's an awareness about how dangerous and how these things, so that the average person, not just people that are addicted to drugs, know where, what to look for and make certain that they don't experiment with something like that. Secondly, I think that we have to certainly look at things like where these people that have challenges, maybe that are addicts, etc., how do they get the supports from our health services? And I think that it's exploded, and that's part of the reason that it's in crisis mode. And really, it's going to take resources, focus, and dollars to try and make these things have solutions.
So third question here, the BC government plans to implement a $15 an hour minimum wage. Do you support this, and would you implement it sooner or later?
Well, I think that for, being a business owner, I think that people that are definitely, affected by the lower minimum wages, restaurants would be a good example, in terms of how do they attract servers and people that are going to work in their business, whether it's the dish pit or whatever. Having a business where the perception, I have a farm, and it would be perceived that our wages would be only at minimum. We have paid well above minimum wage for many years because the competitiveness of the marketplace. So I think that businesses, that in itself is driving wages, and this year will be just under 15 for just our entry point people working in our business. So I don't think that it's that far off, but I think imposed without strategic kind of consultation about the way that the government should implement these things. And I would suggest that Ontario's approach has been, kind of one that's shocked the system, and I don't think that that's the way to approach things. I think that we have to do more to make certain that people find their way to better paying jobs, and that we, hopefully we can, use automation or other things like that, which we're looking a lot at in terms of our business. It's very labor intensive, a lot of handwork, and we're looking at automating and using innovation to try to, kind of take that out of it and being able to give people better opportunities, more complex type of jobs.
Okay. Excuse me. So Kelowna General is already over capacity hospital. It's not even peak flu season yet. It's getting there. How do you plan to deal with the patient overload and long wait times?
Well, I think that the perception is there's long wait times and overload, and I've had lots of personal experience with KGH in the last few months, just with family, and I would say that the numbers have steadily improved. There's been a lot of investment in the way that the procedures are being done, the way that doctors have access to whether it's CT scans or MRIs and these type of things. I was on the Hospital Foundation probably about 20 years ago, and we were sharing a MRI with Kamloops and Prince George. It was a mobile MRI, and we built the cancer center when I was on the foundation. And I look at how far the KGH has gone on the level of care, and I have people that are using the new Interior Heart and Surgical Center. We're so much further ahead, and that's where, when you stop funding infrastructure, and that's one of the legacies that our government has funded so much in infrastructure in schools and hospitals, etc. It takes time to catch up, but the new medical school here is delivering 36 doctors a year right here in Kelowna.
Okay. So transportation, urban sprawl is impacting transit across Kelowna. How do you solve the lack of transportation issue?
Well, I think that this goes back to the growth issue in the economy. And one of the things that I think that local government, most communities, they're happy to kind of, maintain or grow a little bit. We're growing at like 3% per year on a compound basis. That's a difficult growth rate. So one of the things that I have really suggested is that we need to make certain that our local governments are looking ahead at where land will be available for future development, what that infrastructure looks like, where the water's going to come from, and not try to find these stopgap kind of measures. And I say that meaning I was involved in the last bridge upgrade, and I still don't think that we got it right because we were looking at too narrow a window. And I think that the problem really is where are we going to look to the future, and how are people going to move? And it's going to be different than what it is today.
Childcare is next. It costs in BC costs upwards of $1,000 a month. Do you support universal childcare?
Well, certainly one of the things that I think that we've done in terms of we've made childcare unaffordable for families. I have a daughter with 3 granddaughters, and I know I was shocked when I heard what she was having to pay, and how you manage that. I think that one of the things we've done is we've created a lot of rules around childcare that I think have added to the cost. We don't bring on enough early childhood or people that can work in these facilities, and I think that we have to find a way to making certain that the system is not overly regulated. I think about my kids, and they went to Storyland Daycare with, just down the street, and it was at a house that was, we were all happy to, have the kids go there, and Mrs. Ryder, who was a fabulous, person, and she knew kids.
Shout out to Mrs. Ryder.
Yeah, that's right.
Okay. So student debts, we're talking about education now. Excuse me. Student debt is averaging $25,000 or more. Some parties are looking to the European model, offering free tuition. What do you propose?
Well, I think that, having grown up in a time when we kind of had to, kind of have summer jobs. I've worked outside of our family business since I was about 14, and I have to say that, there's options out there for people to, get some work experience and gather some of that resources to help start on that. I think that the government has done a lot in terms of registered education savings plan, and plus the fact that in British Columbia we introduced a matching grant for families with new babies that were born while I was in government. So that's part of the solution. The other part of it, I think, really is that I think that relief from that as you start off, and I think we do this with doctors in rural places. We want doctors in rural and remote communities. We forgive or accelerate their payments in terms of making certain that they can reduce that debt. So I think that that's probably a way that we need to be doing that, and that works not just for professions like medical people, but what about tradespeople? We need more carpenters, we need electricians, etc. Let's find a way to make it so that people want to go into that profession, and that, the 4 years that it takes to become a journeyman and working, etc., that there's options.
So ICBC and BC Hydro are 2 businesses run by the government. Do you think the BC government should be involved in business?
I think that when it comes to hydro, which is a long-term legacy, of former governments here, I think that people expect the government to make certain that there is reliable, safe, clean power that's coming to their doorstep, and that's really what BC Hydro has been doing. ICBC, on the other hand, there's been changes that, the increased costs that are being talked about are something that's a result of increased claims, as well as the fact that liability has skyrocketed. And so, not just liability, sorry, the fact that cars, the frequency of accidents, that probably is a congestion issue as well as maybe distracted driving. The government has worked really hard to try to, maintain a very level and affordable level of insurance. But I think that probably we need to look at all options in terms of ICBC, in terms of the solutions, whether the government continues to be in the business of running a crown corporation like ICBC.
Okay, thank you very much. So we're out of time, so I'll give you just a few seconds here. What do you want your viewers to know about your platform?
Well, I think that one of the things that I'd like them to know is that, having lived in this community my entire life, one of the things that I think that most people that work in government or in, areas such as the arts or things that I've worked on here, know that I'm a consensus-driven individual looking for solutions. And there's lots of problems out there, but if you don't look for solutions, you really get nowhere. And that's one of the reasons why I wanted to continue to give back and represent Kelowna-West.
Okay, thanks so much, Ben. I appreciate you being
Liz.
here. And for KelownaNow, I'm Liz. Great.